Welcome to the panel. I'm Seguin. You won't find the COVID-19 lessons learned review on any bestsellers list, but it's an important work. It's an independently produced report which assessed how the provincial government in British Columbia responded to the pandemic. Now, that report says the government's response was strong, resilient, balanced, and nimble, but it provides 26 recommendations on how the province could do a better job in the future responding to a public health emergency. And here's how that British Columbia report is relevant to New Brunswick, relevant to you. The report raises concerns about how transparent the province was over whether public health care decisions were supported by or followed scientific evidence. The report says trust in government was relatively high until August of 2022. And at that point, trust in government started to drop to the point the report recommends, quote, ways be found to rebuild trust, which will be necessary to support compliance with future restrictive measures should they be needed, end quote. Now, as you know, many New Brunswickers also have similar concerns about transparency, about whether pandemic decisions were made with sufficient, credible science to back them up. And it's not a stretch, I suppose, to suggest some New Brunswickers have also experienced a loss of trust in government due to various decisions made during the pandemic. The Auditor General, as you know, is currently conducting a review of the province's response, and that review will be released in June and December of next year. So, tonight on the panel, we're asking the question, how did public health/government handle the pandemic? Joining me, New Brunswick's Health Minister, Bruce Fitch, Liberal leader Susan Holt is here, and so is the leader of New Brunswick's Green Party, David Coon. Mr. Fitch, in British Columbia, stakeholders raised concerns about transparency, about whether public health care decisions were based on sound science. Trust in government dropped to the point that trust needs to be rebuilt. Would you be surprised if those sentiments were expressed by New Brunswickers?
No, I wouldn't be.
Why?
Well, it's an interesting, feeling these days that just no matter what the institution, there seems to be a general lack of trust. And I've seen it just in the whole sort of evolution from the pandemic, where, like you say, initially the trust was high, and then as time wore on, people became angrier, they became more aggressive. We saw the truckers' convoy, which again took on a life of its own, which again was an unfortunate event that I think again gave sort of social license to people to attack government or attack politicians, regardless of the whether it was personally or again on the policies. So every action just seemed to be a cause for a negative reaction. And I've been around for 20 years, so really right now it seems to be almost in a critical stage of again, being under the microscope, and no matter what happens, there's always an issue. I mean, we sign right to information and release hundreds of pages, and I think there was one almost 1,000 pages of documents under RTI. Which again, somebody would poke through that and look at it and maybe take out one or two reports that may not be in context of the whole package or some of the decisions that are made. So I'm anxious to see the Auditor General's report. I know it's coming out in a number of months, but I'd be interested to see what kind of work was done.
Do you think New Brunswickers would share the same concern about lack of transparency?
Well, again, everybody may look at the same data and say, great, that's good, but the attitude these days are, I don't trust anybody, or especially if you're an elected official, there's people sniping at you, and with the advent of Twitter these days, people can assassinate you in 120 characters, and it can be a total lie. A bold-faced lie based on a grudge or a past experience or something, maybe they're just having a bad day.
Susan Holt, would you be surprised if New Brunswickers said the same, expressed the same concerns that New Brunswick or British Columbians have?
Not at all. They're already expressing it today. New Brunswickers have lost trust in this government and unfortunately in public health because of the complete lack of communication that there's been since February. So I will say we were on a good track. There was daily press conferences happening. There was regular communication. New Brunswickers who were concerned and stressed out about what was happening were getting those fears assuaged by the communication that the government was putting out until they went completely radio silent after February. And since then, I mean, at that point, since February, we've had more deaths from COVID since then than we had beforehand. And yet there's been no information, and the public has had to do the RTI process that Minister Fitch just described to try and get at some of that information because it wasn't being provided proactively, only to learn that there was information being held that wasn't being communicated. Media has been asking questions. When I get multiple media outlets telling me that they're making requests of public health and more than a month has gone by before they've been responded to, I think this government has deserved the label of not transparent and not communicating, which is contributing to the stress and the fears of New Brunswickers, particularly right now, where we have other public health officials in other provinces communicating actively about the increased risks that we're seeing, particularly to kids. We've got parents and teachers stressed out. We've got a healthcare system that's broken, and we have radio silence from this government. So I think that trust is completely gone.
Yeah, I'd like to clarify the radio silence because the COVID report is put out every Tuesday. There's an influenza report put out. The public chief officer, the acting chief officer, was available a couple of weeks ago. So radio silence is a little severe, and I would just suggest that I have the facts that say that's
Well, maybe it's a question of being in touch with New Brunswickers and what they need, because a PDF on a government website that lands once a week is not good communication practices. That's not where New Brunswickers get their news. And so if you want to use yesterday's approach to post a PDF and say that you're doing your job and communicating public health information, I think the government could take better tactics like they used to. You used to be able to go to Facebook and see a live streamed information being presented by public health officials, and that's not in place anymore. He talks about making the chief medical health officer available in private to media, who then put that into places that are paywalled, and it's not accessible, it's not modern, it's not meeting the needs of New Brunswickers or parents or healthcare professionals or teachers or people who are trying to make decisions in the best interest of the public's health.
David Coon, would you be surprised if New Brunswickers expressed the same concerns that British Columbians have?
No, I wouldn't. And I think the question is, where did it begin to go wrong? Because in the first year or so of the effort to battle the pandemic, we did well. We had an all-party cabinet committee that worked very well together. I think it's important to think back to those times.
Right.
There was a lot of fear. There was no vaccination. There was no vaccine at all. With the unified voice of all the parties around, the measures that were taken and the input we had as leaders into that, measures were taken, strong measures that saved a lot of lives in this province. A lot of lives were saved because of the measures that were taken in New Brunswick. Now, what happened to that?
Well, what do you think happened?
Well, it's my rhetorical question. Where I began to see it, where I saw it change was a year ago June, let's say.
New Brunswick.
No, before that, when the Premier decided to ignore the advice of public health on the threshold they had said of vaccination rates that needed to be achieved before relaxing any public health standards, and he went ahead and relaxed public health standards and measures before that threshold was met by a long ways in terms of the vaccination rates. That was for me the turning point, and unfortunately public health went along with it at the time. And so things really started to change there, and then that was followed up after all public health measures were lifted in August. The Deputy Chief Medical Officer of Health at the end of that month says, wait a minute, we've got a problem. We've got a new variant. It's ripping through the population. We need to go back to masking. And it took a month for government to take that advice and put masking back in place. So that's where things changed. So once there was a level of confidence with vaccines in play, and with more knowledge about the virus, because the other thing that's important to remember was this was a novel virus, never been seen before. Never been seen before. The pandemic plan that New Brunswick had was useless for this virus, because it was a novel virus with no vaccine to deal with it. The plan we had was based on, back when we had the swine flu epidemic, and we had immunization for that, and it was, the plan was kind of built on that. So we were in really uncharted waters, but once there was a level of confidence on the side of the Premier in particular, I would say that things were in some ways in hand with a vaccine, and then you started to see decisions made that didn't reflect what public health was saying.
Okay, Mr. Fitch, I want to pick up on what Mr. Coon was saying. How did we go, and I think this is a question that many people have, how did we go from an environment in our province where we had the province divided into zones, some zones were red, some were orange, people weren't supposed to travel from an area with a high infection rate to other zones. We have Safe 6, I'm sure you remember that. So we had all of those restrictions, and then all of a sudden, our approach changed. So do you have any insight into what analytics were used to change our approach, to go from hyper-cautious to...
Well, and again, you're kind of simplifying the whole thing. And to
That's my job.
Yeah. To Mr. Coon's point about, public health being there and going along with that. Again, those recommendations from public health, again, encompassed a significant number of people, significant number of researchers. And again, it's not just here in New Brunswick, but right across Canada, where Dr. Tam, again, is in touch with each provincial public health chief medical officer. So there's a lot going on, a lot of moving parts, and nobody saw Omicron virus coming up, which again, just put things right back. And it's too bad the Liberal leader, resigned. And Mr. Coon, I understand we've chatted about that. But again, it's
Sorry,
true.
I missed the reference there.
Oh, well, the committee, the all-COVID committee.
Oh, okay.
The leaders resigned.
Well, the committee was dismantled in the summer when all restrictions were lifted by government, right? And then the Premier decided to try and bring it back together. And I had said to the Premier there are certain conditions I wanted met to come back on the committee. He said, I'll put those in writing. I never saw them in writing.
Yeah. And again, this is part of the challenge of looking in the rearview mirror. And it's easy to say, well, that should have happened, or that could have happened, that didn't happen, and that's what caused, this event.
So let me just interrupt you for 1 sec. So the question I asked was, what analytics did we use to change our approach? And you referred to the federal health minister, Teresa Tam, Dr. Tam. So who was calling the shots? Was it the feds or?
And again, that's that conversation with public health. And public health is an independent body that advises the government on, direction to take. Now, I know the Liberals put a bill on the floor of the legislature wanting to dictate to the chief medical officer and to public health how they should act. That's not independence. That's political interference, which, again, is a nuance that in opposition you could probably get away with. But if this government started directing the chief officer when to come out, what to say, how to do, we'd get called for political interference right away. But back to your original point of the analytics that occurs here. It wasn't just Premier Higgs and the cabinet sitting there going, well, hey, let's take the masks off.
The economy is hurting, let's move this along.
Yeah, exactly.
That didn't happen?
It was a whole, again, continuum of expertise based on public health, not just the New Brunswick chief medical officer, but all right across New Brunswick, right across the federation.
Was there a coordinated effort coming from the chief medical officer of health for the country, trickled down to the provincial chief medical officers of health?
It wasn't quite that way. The provincial medical officers of health met weekly through much of the pandemic with the chief medical officer of health for Canada. So they were in contact every week And so it wasn't a trickle-down thing.
It was coordinated?
There was a collaborative going on nationally, again, because it was a novel virus we'd never faced before. We had no vaccine. It was exactly what we needed to happen, to have those medical officers of health across the country work together on behalf of all Canadians with Dr. Tam. And I think it worked well. How else are you going to manage something of this scale and of this novelty in a negative way, that other than doing that, bring those with the greatest public health expertise together? They're all drawing on their local expertise and coming up with a good way forward for the country, and then the provinces would implement parts of that in their own case and do other things that were more specific to our province's needs.
Okay, go ahead.
Well, I think there's a critical point here that Minister Fitch was trying to make about the independence of the Office of Public Health, because I think that's where New Brunswickers have lost faith that the office is truly independent because of the politicization that we've seen of the communications and of access to them, of information that hasn't been shared, and it's consistent with the culture that we've seen demonstrated with this government. So civil servants are afraid to speak out. They see what happens to deputy ministers and other leaders who have been fired or let go if they do something that goes against a political will or a political agenda. So I
Are
think
you talking
that
about
has,
education now?
well, that's happened in education. It also happened in other parts of.
Officers of Health. The Liberals fired the Chief Medical Officer of Health, Dr. Cleary. I mean,
there's a
caused
culture
chill in
here.
public health right
There's
there.
a culture here that people know that you don't speak out against this government or these teams, and you get their approval to do everything because it's all centralized in one office where the decisions are being made. So I think the public's faith in the independence of public health is really low, and the lack of communication adds to that.
Okay.
Institutions matter. This is the thing. Institutions matter, and governments have a responsibility to support the independence and the integrity of our institutions like public health. And I haven't seen that. I haven't seen that with the Liberals, and increasingly haven't seen it with the Conservatives. You know, the public health has gone to ground. We haven't seen our Chief Medical Officer of Health. Well, she's on leave, but we're short two medical officers of health. The Regional Medical Officer of Health for the Moncton area is operating as the Deputy Medical Officer of Health, and now he's acting as the Chief Medical Officer of Health. And those other things are vacant or empty. So it's a problem. Our public health doctors are the doctors of the population. That's the way it's supposed to work. They are supposed to speak directly to the population about those matters that concern the population. We collectively are their patients. And so they have this dual role where on the one hand they took a Hippocratic oath and they are responsible to us as their patients, as the population. They also are public servants and they're responsible to their minister. It's a fine line to walk, but the patient-doctor relationship has been missing for the last 8 months.
Mr. Fitch, I'm going to let you respond.
Well, no, and Mr. Coon makes a good point, not just that the Brian Glantz actions with respect to the Chief Medical Officer, but also on just the dynamic of Dr. Legier, who's doing basically two jobs as again, Dr. Russell is off. So I mean, and then you have people say, well, he should be in front of the media every day talking to the people, which again, is that the best use of his time when we need to make sure all these other things are happening and are covered to do the relationship and the job that Mr. Coon talks about?
Just on that point, you know, right now, if you look at the COVID situation in the province right now, numbers are climbing. So numbers are climbing and reporters want to hear from the health authority in the province what is being done, what should we be doing, what measures are being taken, and
Well,
the
he
doctor
was-
says, I'm not available.
No,
And
no, no,
understand
no,
it because
sorry,
he's
Terry.
busy.
I'll just, on that point, he came out and gave a long list of things we should be doing, we as a population. And I don't, well, you know the list, if you want, I can go through it.
But he's not talking to us as a population. And you know, there are 4 other medical officers of health, and maybe one of those are a better communicator than Dr. Legier, more comfortable in front of the cameras, I don't know. But any one of them could be deputized to speak to us as the patients, as their patients, as
I'd
public
love to
health
hear
doctors.
Minister Fitch give the list that because clearly the health officer did it to a media who covered it in pieces, which again is a form of consumption that the public it doesn't guarantee you access. So what were those recommendations?
Well, why don't you give it, and if you leave some out, I'll tell you.
Oh, that's clever. Okay, let's.
Well,
let me ask-
I'd like to stick with that, though, because David made the point that at one point, Dr. Legere raised an issue, and it took a month for the government to then act on it or make a decision. And I think this is happening again because more than 3 weeks ago, he was given a limited media availability, expressed concerns, and since then, we've had chief medical health officers in our neighboring provinces, the CDC, and others say we are in dire straits here, and the public has no idea under what conditions we might hear from him next. Is there a threshold? Is there data? When we've got the amount of kids, BC just reported 6 children died of the flu in 2 weeks, when normally they see 1 death in a year. And you go to the grocery store and you cannot find medication on the shelf for your kid. And you go to school and you find a third of the kids are out and the teachers are unmasked. And you go to the ER and there's not enough staff there. Maybe the same in the Office of Public Health, there isn't enough staff. And we have a situation on our hands where people are looking to the government for information to manage their own safety, and we're getting nothing.
And let me elaborate on that. Sorry, Mr. Coon, just give me 1 sec. Cases and hospitalizations are up. 6 more New Brunswickers died from COVID between November 27th and December 3rd. More than 1,000 new cases of COVID this past week. 100 students in Sackville absent. 9 classes canceled in Francophone South School District. So you can understand why we would want to hear from the acting health authority. Some people might be alarmed by those numbers. So for context, you would go to the person the government has designated spokesperson, and if he's unavailable, there's a vacuum there, isn't there? Would you agree with that?
Well, and again, people have a certain expectation of how and what the chief medical officer should do. Again, when you look at the number of questions that come in from the media, the endeavor has occurred that it's researched and replied. Now, some people have an issue with the timeline, but my understanding the turnaround is very quick and very reasonable. He also said that, again, if there are significant developments, he would be out and back talking to the public.
Isn't that significant, though?
It's taking over a month for reporters to get their questions answered. It's take over a month for his flags from the last time to get answered. We don't have a month right now when you have chief medical health officers in Nova Scotia issuing strong concerns about the need to get vaccinated for the flu and for COVID, the need for masking. You have the CDC coming out and say we have a need for masking, and we have silence that this government is propagating.
So without Dr. Russell there, when she's on leave, there's a lack of leadership in the institution of public health, right? She's the chief, and she would be out there, I'm sure. She's off. There hasn't been the work done to ensure that the necessary leadership is there at public health. For some reason, I don't know why.
Whose responsibility is that?
Well,
is that the minister's?
It's the minister, of course. He's accountable ultimately. You've got 5 medical officers of health altogether, 4 regional plus Dr. Legere, and that's a team, as you know. I don't obviously need to tell you that, but it's a team. So among that team, likely there is one who's a particularly good communicator who perhaps should be touched for being out there talking to us, the patients of our public health doctors. And that's not been the case. We have Dr. Legere. I'm sure he's doing a great job on his day-to-day work, but the public dimension to that leadership, public health leadership, is just missing right now.
Okay, let me ask you this question.
Yeah, and can I just
yeah,
touch
please
on this
do,
4
please
weeks
do.
again?
Yep, go ahead.
You know, and again, it could be an outlier, but again, when you say it over and over and over again, you make it look or sound
Well,
like
both the
it's...
CBC and Brunswick News have confirmed that it took more than a month for them to receive requests of the medical health office to their questions. That's too long for public health.
So did they give the whole continuum of how many questions they've asked, how depth they've asked, how many they've gone back, and how soon? Do you have that
if they
whole
asked one
rubric
question,
figured
they'd
out?
get a quick answer, but because they asked too many, they have to wait a month?
Depending on the nature and
That's
the depth
ridiculous.
of the
Do you know that to be a fact? I mean, was it the nature or the complexity of the questions that was the problem?
I don't have the list of all the questions that
Okay.
are being talked about here today, so I really can't comment on exactly the depth or the amount. But let me tell you, when there's reams and reams and reams of research that's done, and that's why when I release an RTI, people go in and they may take some things out there that are very obscure or not part of that overall context, and ask a question based on
But
that.
maybe
So
there's an
people-
issue
that goes back to research. So again, I know that the Liberals want to control the public chief medical officer and dictate to them that was the motion that was on the floor today.
What the Liberals would
And
like is
I don't know
open
who wrote
data,
that. I don't know who wrote that, but I
transparency,
could take a
access
guess
to the
pretty
information
quick.
that would allow us to control our health. And there is not good information being shared. We need openness. People shouldn't have to RTI to get information on
and
their
they
health.
don't.
Public groups shouldn't have to sprout up to fill the void in
And that
public
has
health
happened.
communication.
That has happened. Mr. Coon, you wanted to say something.
I was just going to say, when CBC can't get public health after trying week after week after week, and they go to the past president of the New Brunswick Medical Society, Dr. McMillan, to speak in their place. And he was on the CBC talking about sort of the state of infectious diseases in the province and how to think about them and what people should be doing in response. That's the role of the Chief Medical Officer of Health or one of their
Do
other
you
medical
agree
officers of
that
health.
That's your department's responsibility?
Well, again, public health has a role and responsibility. People are taking offense that the individual is not available to their liking. And again,
It's not to our liking.
This is
Well,
a
it's-
failure
it's
of
the New
leadership.
Brunswickers'
So if
liking.
somebody can't be made available, as government, it is your responsibility to provide New Brunswickers with the information they need to stay safe and healthy. And you're failing in that leadership and
well,
responsibility.
the information was provided and a lot of people didn't follow it. So, again.
Whose responsibility is that?
Okay, so I'm hearing that you want to bring mask mandates back. Is that what you're saying?
I would like to hear from public health on the data that they have in front of them today, because when CDC is calling for masks and Dr. Strang is calling for masks, and we hear from the chief medical officer on November 18th that he thinks that we should be moving to indoor masking, and yet there's silence from government. I would like to know what data makes me feel better as a parent and as a New Brunswicker to send my kids to school and know that they're going to be safe.
Well, and I think this was part of the conversation about the personal choice that people make, whether they wear masks or not wear masks, and what they're comfortable with.
To make
So
that
this
personal
is-
choice, we need information.
Okay, great. Let me just move this on. I went to look for a mandate for public health because the focus that we're looking at here is, did public health meet the expectations of New Brunswickers? And I went to look for a mandate, and I went through the whole org chart in the department, and it seemed to me that there are 4 key units in public health that would be involved in a pandemic response: the epidemiology and surveillance unit, the health analytics branch, the prevention and control unit, and the health emergency branch. Now, in the org chart for each of those branches, you are at the top. So everybody in those branches is reporting to you. You're their boss, in effect. So I guess what I'm wondering is, from when the pandemic started, and those units are meeting to discuss pandemic strategy, what is the health minister's job at that meeting?
Well, and again, depending on what meeting you're talking about.
We've got a pandemic, what are we going to do?
Yeah, whether
You're
it's
the
a
guy in
cabinet
charge.
meeting,
Are you
know,
there?
The COVID cabinet, again, the number of meetings is quite extensive.
I'll bet.
And I don't know how you want to break it down, but because there's staff meetings, there's various level of staff meetings, subcommittees, sub-meetings, and then it all flows up and eventually ends up in cabinet.
But this
where
is a
the
new
minister
structure,
is-
too. This is a
is
new
present.
structure. This wasn't the structure that was there before. And I've been wondering about that because health is reorganized the way it's organized, right? And so before, the Chief Medical Officer of Health had all the public health people under her, basically. And now that's not the case. She has her regional medical officers of health working with her, and then all these other folks and the epidemiologists, but the rest of them report up through an assistant deputy minister,
Right.
deputy minister.
Right.
So there's been this separation between part of the public health team and the physicians, the medical officers of health and the epidemiologists. I think when I saw that happen, I thought that's going to cause problems. That's going to cause problems because all those other folks that you listed off there, except the epidemiologists, are reporting up through an assistant deputy minister not to the medical officer of health, chief medical officer of health, and they are firmly entrenched inside the bureaucracy, where in the chief medical officer of health's office, you have a more quasi-independent situation. So that divides the capacity of public health to do its job.
Okay, so this is where I'm going with this, because I know you're wondering. Because you're at the top of the org chart, and there is some people in this province believe, and I think there's been a reference to it earlier, that somehow the mission of public health was compromised by politics. So you're at the top of all of these groups that are talking how they're going to handle the pandemic. Isn't there an opportunity there for you as a member of the government to say, look, I know that you're working on a pandemic plan, but our concern really is that we don't kill the economy with anything you do. Isn't there an opportunity there for you to inject agenda politics into the discourse about how to resolve the pandemic or how to deal with the pandemic? That's a serious question.
Yeah, it is. And you're right, because every time you changed a mandate, either lifted it or enforced it, you had different camps, different groups saying you didn't go far enough or you went too far, put the masks on, take the masks off. There were a lot of moving parts, plus the overall economy as well, which again had a strong voice. But I go back to, again, from memory here, in the meetings where, again, public health had that independent, the chief medical officer would come in, make those recommendations based on a significant amount of research that they had done in collaboration and in discussion with, the other folks across the province or across the federation, and with Dr. Tam. And actually, Dr. Legier did a joint presentation with Dr. Tam to the federal, provincial, territory ministers here back in the 1st of November. So again, being part of that group, again, he is fulfilling that role. And the coordination and discussion between the federal minister, chief medical officer, and the provincial ones is still occurring. There's still that collaboration going on.
But what's your relationship, though, with the acting chief medical officer of health? You're the minister. He reports to you. I mean, what's that look like?
Technically, through the deputy minister,
Right,
and the deputy
yeah.
minister reports to me.
That's right.
So
And
on
are
the
you
day-to-day,
rubber-stamping
and
stuff,
the
or-
day-to-day
And there's been 4
operations.
different deputy ministers and 2 different ministers over the time. So there is a lot of upheaval in the Department
but
of
now
Health.
there's one deputy minister and there's one minister, and I want to know what is the relationship with Dr. Legier as acting chief medical officer of health with you, through the deputy? How's that?
We have
working?
briefings, I was going to say on a weekly basis, maybe not every week, but I know on a weekly basis we have meetings with the CEOs, the trustees, and part of that discussion is with the chief medical officer or his staff or designate.
You mentioned a moment ago that the decisions that are made are based on scientific research, and I want to pick out one specific incident because it seems to be the lightning rod for a lot of the skepticism that is emerging about how things are being done within government. And that was when the Chief Medical Officer of Health removed mask mandates in the schools in March of 2022 based on what appeared to be a single scientifically questionable report, and then the Chief Medical Officer of Health doing an all-points call for any information that might back up the decision that had already been made. How is that a credible approach to protecting public health? Why was the mandate removed when you had the Child and Youth Advocate recommended restoring the mandate, 40 of 54 actively practicing pediatricians in the province saying you really should reinstate mandatory universal masking, and yet it wasn't done? So where was the science in that decision?
I'd have to, again, go back and look at the details of that particular incident. I
You
do
know the
remember.
controversy,
I do
right?
remember, yeah, and I do remember the Minister of Education at the time coming out and saying it wasn't what he would want, but taking the advice of the Chief Medical Officer.
Right.
If I'm remembering the right incident,
Well, sure,
or
but
the right time.
But the one study that it was based on was really not even a study per se. I mean, what are your thoughts on that particular incident?
Well, I think it's an example of the other one that's come up more recently, where there was a ton of good data provided to public health from Dr. Teresa Tam and others around long COVID that was not communicated with the public. So it creates a fear that there's a political layer on top of this information and decisions that's preventing public health from communicating the way that they would want to and the way New Brunswickers need, because their data, their expert advice doesn't meet the political agenda of this government. So that fear exists, and that lack of trust is there. And then we have examples that show that we're trying to come up with evidence to support policy rather than, policy to support evidence rather
Right.
than evidence to support policy.
Because you know, the suggestion that is on the table now is that because you are at the top of the org chart for these groups in public health, that there's a possibility, or there's a perception that there's a possibility, that your thumb could be on the scale. So if someone's thinking, I know you're grinning because it seems implausible, but
I was thinking of the number of conspiracy theories that have been promoted over the last couple of years, and thus the.
okay, but
so there are a lot of them, that's for sure.
the fact that you're at the top of the org chart, you're the boss, isn't a conspiracy theory. You're the boss. So the person reporting to you would probably be aware whether your government wants to bring back a mask mandate or not.
And again, those are discussions that will occur as time goes on and as recommendations come out of the chief medical officer. And the relationship, whether it's minister, deputy minister on the day-to-day things. People again have certain expectations of elected officials that sometimes are unrealistic. But again, trying to work collaboratively as a team right across the different sectors, whether it's education, social development, health, and post-secondary education.
Terry, I think a great way to counteract conspiracy theories is with communication. You make data open and available. You're transparent. You're communicating frequently and in modern ways that respond to the needs of New Brunswickers. When things are quiet, that's when people's ideas go wild and people's
In a
fears
vacuum.
and stresses in a vacuum. So if there's no conspiracy theory, then regular open communication and the leadership that goes with that to make data available frequently and in a timely way, because that's really what's missing here, would make the difference. And the
Even-
government is choosing not to communicate.
Even during the worst of COVID, it was difficult to get public health to provide illustrative data to the public in the briefings. I remember saying one time to the chief medical officer of health, can't you put up a slide? And she asked the communications people, can I do that? And they said, yeah. And so she said, oh, well, let's do that. Because it improves the communication, illustrating what she's talking about, making it clearer for people, because sometimes the science was changing so rapidly, people were getting lost and understandably confused about where we were today. But that was because it was a novel virus, and the science kept changing and improving, and so we were learning new things, weekly and monthly. So that's been a problem all the way along in terms of communication, not just now, but before. The communications dimension to this since the beginning has not been what it should be. I remember advocating publicly right at the beginning that public health needs a health communicator on staff, someone who's knowledgeable around health matters and therefore can communicate it in plain, comprehensible language, and a behavioral scientist to understand how people respond to public health measures and how to craft them in ways that are going to be most effective, and to advise when not to sort of change directions in mid-course and lose the confidence of the people, because suddenly we were doing this, now we're being told to do that, and that doesn't make any sense. You want to avoid those things, and we ran into that too many times, unfortunately.
Mr. Fitch, do you think the credibility of the public health department has been affected by how it's handled the pandemic? What is you're a pragmatic guy. What do you think?
Thanks, appreciate that. And to Mr. Coon's point, things are changing, we're changing through the pandemic. If we're looking back or looking ahead, I guess we've gone both directions here today. But it was basically a book with nothing written in it. There wasn't a playbook of here's what to do. And so sometimes even just that whole idea of Tuesday you make a decision, and by Friday, when you get it written up and printed and communicated in as good a method as I mean, some people were okay with it, some, and then having to write all the whole order, the public order, there was a lot of work going on that again was important to do. So going back to your original question, sorry, I digress.
That's all right.
Because we're not in that situation now. That was
No,
then.
no, I know
This
that
is
was
now.
them, and that's why I was saying, well, are we looking back or are we looking forward?
Right. Well,
Which
let's
way?
look forward.
You have to have
look
eyes in the
forward
back
now,
of your head.
Because let's assume that what they found in BC
Sure.
is relevant to New Brunswick, and people have lost some trust.
And let's go back, because I think as things progressed and as the pandemic took hold, you know, there was a significant amount of confidence. But and everybody thought, oh, in a year it'll be gone. But it's stretched on and is still with us now. So people, and I mentioned it earlier, it's affected us, even if you didn't catch COVID. It's affected everybody, whether it's isolation, whether it was, and this has led to some of the challenges we're seeing today in the emergency rooms, in healthcare, and whatever. So that has caused the public, and when I say the public in general, affecting some more than others, to really be disappointed or not trusting. And I've seen it, you know, I mean, the emails come in constantly and the questions, and we try to get the answers out to them. And some of them are so, you know, don't go directly to me, but go directly to public health, and again, trying to manage that. But, and I mean, when we had Dr. Russell and Minister Shepherd out, and even the Premier out, I think a lot of people liked that or had that expectation that should continue. But again, part of doing the job, and as Mr. Coon said, there's a lot to be done and a lot going on. Having a news conference every day or every second day probably, you know, is what the expectation is, but maybe it's not as
Well,
What
realistic.
impact
being
did-
invisible is the problem.
So, yeah,
That's
so
the problem.
that again, and the being the opposition, it's a good time to poke at stuff like that, which again creates an unease or an uncertainty
But if
for
there
the
was sufficient
credibility of them.
communication, we wouldn't have to poke, right? It's this vacuum, this radio silence.
So why
that
does
is-
government, why, okay,
Well, I
what
think
goal,
I
what
spoke about the
motivation would there
radio
be for
silent.
government to go radio silent?
Well, the
What-
reports are
what do you
coming out
think?
every
I,
week.
well, I
The
can
reports
only
are out every
assume
week.
they've decided that there's this,
So-
that it's not in their political best interests to, even though, as Minister Fitch just said, we have a healthcare system in crisis, right? We have people who are waiting in ERs for 14 hours and people who don't have the information they need to make the best health decisions, and we have no communication coming from public health. If you point to the PDFs one more time, show me a person who's actively going to the GNB site to dig out the place, and those PDFs don't even go back past April of this year. So the approach to communications is not meeting New Brunswickers where they're at, and their expectation that we would go and read a table full of numbers that's put on a website is unrealistic and out of touch.
But this is
They need to take a leadership role and communicate regularly to rebuild trust with New Brunswickers.
But this is, public health is so thin on the ground now. It's lacking in the numbers, the team that it used to have. It's been divided up now inside the Department of Health, and prior to that, the Liberals divided it up and spread key teams around different parts of the public service. So it is extremely weak in terms of its capacity today as an institution compared to what it was like when Dr. Cleary was Chief Medical Officer of Health, or when Dr. McDonald was Chief Medical Officer of Health before that. So they're working with both arms, in a sense, tied behind their back. They don't have the capacity that they need to do the work they should be doing,
We set them up to fail?
and they have been set up to fail.
What influence did the protests in the nation's capital, across the country, and here in New Brunswick have on government's decision-making?
Oh, gosh, that's an
You were at the
interesting
cabinet
question.
table.
Yeah, and there's a confidentiality.
Yeah, I'm not asking you to
agreement.
divulge anything confidential.
Well, that's getting pretty close when
Well,
you
I
ask that
mean,
question.
did it affect policy?
And as I said, I mean, there's a ton of different things going on. But certainly that particular protest, I mean, it crystallized a lot of thoughts for a lot of people, not just politicians. But, you know, it was unfortunate that whole thing had to happen. And again, there was a lot of reaction in Ottawa. They've done a whole, you know, the emergency measures had to be put forward by the Prime Minister. There's you know,
There were protests outside the Premier's home.
Yeah, again, you try to make the decisions as best you can despite the threats or protests or, you know, some of the misinformation that's out there.
But there was an influence?
But look, everything influences every day. I mean,
But that did. Specifically about the protests.
how could it not? How could it not?
Okay, so
You know, but again, I go back to the recommendations of Chief Medical Officer. That is number one when it comes to the decisions that were made.
Well, look, I don't think that there was an answer in that statement, so I'm
you're not sure what to respond to.
It was
well, I'm
pretty
just
clear to me.
coming back to where we are today, right? People are sick and people are scared and it's silent. So we need communication and because it's concerning what's happening in our healthcare system and what's happening in our school system. Information and communication would really help reduce the stress in the public and maybe help people make better health choices, whether that's to mask or to get the vaccine that those haven't yet, or to do things to protect our health as a society.
Okay, let me ask you this. What damage do you think has been done to public health's reputation?
Well, I think it's unfortunate because I think to the point David made, there's great people in public health who are working
Agreed.
hard under very limited resources and in a culture where you know that you don't communicate against government. You don't communicate without permission. You have to get it approved, and clearly it takes a month or so to even get the permission to communicate. So I think it's a tough time to be in public health, right? It's a tough time to be a civil servant right now because we see that if you present the wrong data, you're going to get tossed. And if you speak the wrong way, you're going to get moved to a department or fired.
But
So
the problem is that public health has to use GMB's communications, which is set up to serve their political masters. And so if you're in public health, you don't want that to have to go through that to communicate, but that's your only choice at this point because you don't have your own communications capacity independent of that.
I think that's why it needs independence, independent communications.
Therein lies the problem. They do need to have independent communication capacity. They don't have it. Their team has been so badly diminished over the years, both under the Liberals and now under the Conservatives. They have such broad responsibilities beyond what we're talking about. And
Right.
they're not even
Right.
able to get to those, around drug addictions and alcoholism and all kinds of public health issues that are important, radon in people's basements, increasing their lung cancer risk. I mean, there's all kinds of public health issues.
Okay.
And it's such an important institution in our society that it needs to be built back up, given the resources it needs, provided with the capacity to do its job, and fill those vacancies, which are still waiting to be filled.
So here's the question I have. Do we have enough separation now between the public health practitioners, the people we rely on and expect to protect public health, and the politicians?
Not the way it's organized now.
So what would you change?
So, well, we've argued in the past that Chief Medical Officer of Health could be made an officer of the legislature. Give them that independence so that they report to the Legislative Assembly and to the public and take them out of that hierarchy that exists in the Department of Health and all other departments. Give them that position.
Same question to you, Ms. Holt.
I would agree with what David said. Given the complete lack of trust in the government and by extension public health, I think the opportunity to have them as an independent officer of the legislature is a good one. Because if you look at where trust does exist, it sits with the Auditor General, with the Ombud, with folks who are free to speak and do their own communications without having a political lens or having it pass through the Premier's office to get scrubbed. So I think that would be a start in rebuilding trust. But what we need right now is communication from the minister, from government, or someone to tell us what the risks are to public health today and to get the information flowing. Because New Brunswickers are smart. We can make decisions if we're provided with good information.
Okay, this is an opportunity for me to ask you. Your ambition is to be Premier of the province someday. Certainly, it would appear you would have Mr. Coon's support in the legislature too, making the Chief Medical Officer of Health an officer of the legislature. Is that something that you would want to do?
That's something I think the times call for right now because people have completely lost faith. Right? They look to communications from government and they take it with a huge, unhealthy dose of salt because the cynicism against what's actually being done, access to the data, the reports that we hear coming out from civil servants have really meant that trust is at an all-time low. And we have to take different steps, radical steps to rebuild that trust with the public. And I think that means making information widely available and being transparent and communicative about decisions.
So you would do that. Under a Holt government, the chief medical officer of health would be an officer of the legislature.
That's something I would love to explore. I'd love to
Is
talk
that a
to,
commitment?
I'd love to talk to caucus and the party about it, because what goes in our platform as a Democratic Party needs the contribution of the members of our party and the members of caucus. But it's something I've proposed publicly, that we need to look at this being an independent office of the legislature.
Is that a legitimate concern to you, Mr. Fitch?
And again, I guess the research that I did today didn't include whether we're going to make public health a independent office of the legislature. And I guess I'll use the words of the individual next to me is, I'd have to take a look at that.
But after 2018, when the Liberals had fired Dr. Cleary, your party had campaigned on creating more independence for the Chief Medical Officer of Health.
Well, I think you're seeing it here.
But you haven't delivered.
But we're not dictating to them, go out, have a, do more
But
data.
are
So-
you independent really? If you, in the org chart, and I'm sorry to go back to this, but you're part of the group. Like, you're the boss of all of those
Well, and
groups. So
again-
is there really independence?
Well, when you use the org chart, again, the deputy minister is reporting to the minister. Deputy minister does day-to-day operations. And there are the lines back and forth. Deputy minister also reports to the premier. So, so again, to dictate to the chief medical officer, you have to go out, is not the independence that I think people want. Again, the chief medical officer, I'm sure, will be out in the not too distant future. If he's going to answer all the questions of the members opposite, I'm not sure. But I know that the information that he's, put out before, with the promise that if there's anything significant, it'd come out again. And so I would expect to see him in the not too distant future.
Will you let him speak directly to the public?
Again, I'm not going to dictate, because I don't think that's my role. The chief medical officer has that certain independence
So
that
they're
needs to
free
be
to
done.
communicate without passing it through?
But as minister, you need to be identifying whether the leadership is occurring at public health that should be occurring or not. And I would say it's not. And so you need to do something about that. That's your job.
Thanks.
What should he
Appreciate the advice.
what should he do?
Well, you've got multiple medical officers of health there. Find one that can show the leadership that's necessary to meet the needs of New Brunswickers who's willing to speak to New Brunswickers, give them the confidence they need to help navigate through the current triple threat we've got with COVID and RSV and the flu. The kids are getting sick. I mean, it's bad. It's bad.
And that's not lost, and again, we talked in the House about the number of things that are occurring to try and alleviate some of that. And I know it's minimized by the Liberals or the opposition. It's a great time to be in opposition, I'll tell you that much.
Why?
Well, we are in a difficult period of time, going through a major pandemic, trying to get out of that, and all how that's affected people from a capacity, mental health and
But doesn't the
addictions.
government have
And
responsibility for all of that?
But every time we say, like, we've doubled the amount of money for the homelessness to try and alleviate that problem, it grows. So it's continually trying to catch up right now, and that's what I'm saying. The yabbats on the other side of the floor, when we do something.
The yabbats?
Yeah, but.
We have a responsibility to hold the government to account, but also to help them hear from the folks that they're not hearing from.
Well, we
When
hear
they're out
very
of
loud
touch
and
with
clear.
parents,
No.
with teachers, with healthcare professionals, with the medical society, with folks who are saying, we want information, we need to know what's going on so that we can support our kids and our communities. They're not hearing it from the public, and it's our job to try and amplify that so that, as David said, the leadership delivers the communication that supports public health.
I mean, it is obvious to everyone when you watch the evening news and you see the Chief Medical Officer of Health speaking publicly in BC and in Saskatchewan and in Ontario and in Quebec and in Nova Scotia and Prince Edward Island, and we've got crickets.
Well, like I say, it wouldn't, I'm sure you'll be hearing from the chief medical officer soon. You have heard from him.
When?
And
No, I
it's
didn't.
not,
You spoke to the media privately.
We weren't
Well-
allowed to come and participate in those sessions. So when is he going to
and
speak
again,
next?
no, I said in the near future. I didn't say when or where or how. Because again, it goes back to that independence that I'm trying to protect. you want more independence, yet you're trying to tell the minister to dictate to the chief medical officer. So, I tried to hold the opposition accountable and be consistent with what they do. So we had the
I think maybe
Liberals.
you want to be on the other side of the house. Is that what you're trying to do?
We had two Liberals at a great announcement I made up north. Two of them were there, and there was a little debate on whether I invited them into the picture or they jumped in. Anyways, it was at the.
Why does that matter?
It doesn't.
Why are we
does that
talking about
matter?
that? We're talking about public health here and keeping
I
New
know they
Brunswickers
wanted,
safe.
because in the legislature, they stood against Bill 3. They stood against Bill 3 in the legislature, but up north on the ground, they were more than happy. They were all smiles and handshakes, high fives, but yet in the so I'm just,
So you're
don't
saying
have one
it's
song, don't have one song in the north and one song on the
You're
floor
saying
of
it's
the
theater?
That's just a
Wow.
swirl. Come
Can
on.
we please
But
talk
it's
about
an
public health?
important- Listen, you brought up healthcare and crisis, so let's talk about healthcare and
We haven't
crisis.
got the
And
time,
some of the
No, we
things
don't
that
have the
are, well, no, I'm gonna take the
Oh,
time
Mr.
because
Fitch.
you can't get away with that, to throw out something like that and not have a full discussion and then go in the legislature and vote against Bill 3. That's.
Okay, for people who
What are
don't
you
know
talking
what Bill
about?
3 is.
Bill 3 was allowing services outside the bricks and mortars of a hospital, in a
Surgical
clinic,
services.
Okay.
surgical services,
Okay.
in a clinic. So again, the two members, Liberal members from up there, glad to receive them into the clinic when the ribbon was cut, but yet Bill 3 in the House was voted against it.
There are more like.
Maybe they're
So-
looking for cataract surgery.
So we're trying to solve
We've
the
got
wait
kids
lines
that
and
are
wait
sick.
times.
We've
We're
got a
very
shortage of
selective in-
doctors. We've got
yeah,
a
and
shortage
we're
of
working on that
teachers.
too, working on it.
And you're talking about a
teachers-
photo op in the north?
No,
Like,
Okay.
I'm
what
talking
is
about
going on?
We have-
clinical services that are going to reduce the
We have
wait
30
time and the
seconds.
wait
We have
line.
less than
And
30
you guys
seconds
voted
left.
against
Mr.
it.
Fitch, I
You
want
were
to thank
against
you
it
for
before you
taking
even
the
knew what
time
it
to
was.
come and talk to us. Thank you very much for your time. Susan Holt, thank you very much for your time. David Coon, thank you very
Terry.
much for
As
your
always.
time. And that is the panel for this week. We're still trying to figure out how we're going to approach the Christmas season and the New Year, but once we get that sorted out, we'll be sure to let you know. I want to thank Tara King-Stewart for her work behind the scenes, Jeff Dupre for his work, and thanks again to Rogers for giving us a place to have this kind of discussion. Thanks very much. See you next time.